For the teeth, we have maxillary teeth on the top, and we have mandibular teeth on the bottom. Maxillary and the maxilla bone, mandibular and the mandible jawbone. Now we can have 32 teeth, and we can divide these teeth into quadrants, where we have 8 teeth here in this quadrant, fourth of the mouth, 8 here, 8 in the lower quadrant, and 8 in this lower quadrant. So if we look at them from the front, 4 types of teeth. We have the incisors in the front, which have a flat edge for incising or cutting. 4. 2 central incisors and 2 lateral incisors on the top. Same on the bottom, they're a little smaller on the bottom. 4 incisors. Then in the corners of the mouth, we have canines. Now they're supposed to have a sharp tip called a cusp there. So that's a canine and that's a canine. Then behind the canines, we have 2 premolars, there, and here on the bottom. Now they're called premolars because they're in front of the molars. The molars are big, broad. We can have 3 molars on each side. First molar, second molar, third molar. Third molar is often called the wisdom teeth. Let's look at this side. If we just look at a quadrant, we would see 2 incisors, central and lateral, canine, 2 premolars, and 3 molars here. Now let's look at the upper ones here, okay? On the top. Let me get this to stay still. Okay, we'll do it like this. How about that? Okay, so look, these tips are called cusp. And we said that the canine also is called a cuspid, has 1 sharp cusp there. The incisors have no cusp, they're flat. Right there, 1 cusp or tip. Premolars have 2 cusps, so they're often called bicuspids, 1, 2, 1, 2. And then the molars have 4 cusps, 1, 2, 3, 4. So, starting from the front, incisor, canine, 2 premolars, 3 molars. Look at the bottom. Four incisors there. We have a canine here. 2 premolars, bicuspids, and then 3 molars there. First, second, third, with many cusps. We can see the bone coming up in between the teeth, and of course the gums would be on top of that. This shows a nice quadrant here in the maxillary bone. 2 incisors, flat edges, central incisor, lateral incisor, canine with a pointy tip, cuspid, 2 premolars, which come before the 3 molars. This model is pretty nice because it shows several things. First of all, if I open it up, I can see the layers of the teeth. So you can see how they sit in the bone. Let's look at this one. Nice, happy teeth. 3 layers are the white enamel, the yellow dentin, and this area here, the chamber, the pulp chamber would be where the blood vessels and nerves would be. Sometimes they show that in red. That's the pulp, and the pulp goes down into the roots. So in the crown, which is the top part of the tooth above the bone, we call that the pulp chamber. The roots, which go into the bone, there, that's the pulp canal. Or sometimes they call it a root canal, because that gets filled during root canals. And we can see the periodontal bone here. And then you can see the tip of the pulp canal has an exit called the apical foramen, and that's where the nerve comes in, there. On this side, we can actually see the nerves and blood vessels coming in. The nerves and blood vessels lead up to each tooth and go into each root through that apical foramen. You can easily see the crown of the tooth in white here, and then the gum would come up to about here, because that's the roots. You want the roots covered. Now when we get gum recession, sometimes the gums will recede and you'll see part of the roots. They'll be a little sensitive. That outer layer of the root is actually not enamel, but it does have a little thin covering. It's called cementum. Cementum. Now if I come in here, I can see, I don't know if you remember, the mandibular foramen is where the nerve enters the jaw to go to the teeth. And then it travels along the jawbone and goes to each tooth. But in the mandible, we have to numb the teeth up all at once back here, because this bone is too thick for the anesthetic to get through. In the maxilla, we have a really thin bone layer on top of the roots, so we can numb up each individual tooth. We don't have to numb up the whole side, because their anesthetic can get through that thin bone layer. So here, again, white enamel, yellow dentin, this chamber and canal is the pulp. And they're just a thin outer coating on the roots. Just look at that line there. That would be the cementum. That should do it. We're going to have you maybe film your own teeth so you can show me what you got. I wish we had some tooth models, but we don't. I'll show you them on the PowerPoint.